welcome again, everyone. Thank you also for having me. So as we've said, we'll look at BMJ Journals, BMJ Best Practice, but we'll also mention the other resources available to you, namely BMJ Learning and Case Reports. So for BMJ Learning, I thought I'll highlight a couple of slides from our 2025 impacts report before diving into the website and moving around the site and the resources and the journals you have access to. So BMJ Group is considered, or is within the top 10 policy influencers in healthcare. So as you can see there in the sort of second point, we ranked 8th globally in influencing clinical guidelines and policy documents between 2020 and 2024, and we were cited actually over 6,200 times in new and updated policy documents and clinical guidelines in 2024. If I look at another stat from that slide, we have nearly 80 million users a year that rely on our websites for trusted research and clinical information. In terms of the ranking of our journals, over half of them are within the top quartile, and 20% are in the top 10 of their category, and 8 of our titles actually into top 5 of their category. These are, for those of you who are familiar with impact factor and site score, some of the impact factors of our journals. Well, actually, they've been updated since this slide was sort of split up in the report, but they're not that much different. And they show you again just the ranking in terms of the various leading journals at BMJ that we publish. So I think I'll skip the next few just to save time, but I'll the full reports, including actually. Maybe I'll just put this on the screen, but do have a go on our website and read the full report. It has lots of impact stories, including ones like this around ultra processed foods. As you can see at the bottom here, in terms of the impacts, ripple effects impacts, it was 11 UK Parliament Select Committee reports included this, 3 Food Foundation publications, 5 United Nations documents, and so on. So a lot of impacts on the research that we publish. And there are some other ones around relating to other topics as well. I can put a link in the chat, but it's on our homepage, on the bmjgroup.com homepage. So that was just trying to very briefly highlight some of the impacts of the research that we publish. And I'm just going to go onto our journals website. Now, access to our journals is through Open Athens. We can talk about that a little later in the Q&A as well. But I'm just going to initially just navigate through the sort of the website. If you're more interested in well, if you have an interest in information relating to authors, if you are an author, I'd like some sort of support on that. If you'd like to access our author hub, then click on author support here. You'll find the author hub on the top page here, on the top the top of the page. So you can click on that, and this will have information on writing and formatting, on promoting your manuscripts, how maybe you could put together a little abstract video for your article. So all the various policies relating to publishing with us. So that's for authors. I'm just going to go back to the home page here. Of course, you can sort of browse through our new journal launches, some of those stats that we've seen on the slides earlier. But if you'd like to simply browse our journals, you can click here. And do have different ways of browsing our journals. So here, for example, we can browse by specialty. Further down, you can simply have a list of our journals. And then you can see, of course, some people are interested in open access journals only, for example. We could do that as well. So let's have a look at maybe one or two of these categories. It's fairly straightforward, really. So if I go into nursing, I can open that, go into evidence-based nursing. If I had an interest in public health, I could do that as well and select a journal. Or let's start with general medicine, and we'll start with the BMJ. Of course, you'll find here case reports as well that I mentioned at the start of the session. So if I go into the BMJ, a very quick look at this journal. The look and feel of this journal is a little bit different to the other ones. This is our flagship title, of course, and you'll find here some of the more recent articles that we've published. I do subscribe to the email alerts from this journal. There are two that you can have, and I'll show you how to actually do that in a moment. But on the homepage, you'll see some of the recent articles that have been published. You'll see a little further down the different types of articles, so news, research articles, comments, and education. If I wish to open one of these, let's go into this one here. Summary of WHO clinical guidance on for influenza. This article has a visual summary. These are sort of rapid recommendations. They're really nice. So as you can see, this is the summary of the guidelines, but very nicely visually sort of presented. With these treatments, you can actually hover over them for more details around the dosage and the evidence with all of these. If you do actually continue and click, you'll get into the sort of full detail as well. There is actually an article here as well in text format that you can look at. And of course, there are a number of features on the right-hand side. I'm just going to go back to the home page. Yeah, if you continue further down, you'll get to the current issue as well. If infographics, which is really what we were looking at just there, if those are of interest to you, then you can look at the archive and view all of our previous infographics. They should be in here somewhere. Yep, there at the bottom. You can get to our YouTube channel from here, podcast archive. So a lot of the journals will have their podcasts as well, like the BMJ. I think I'll stop at that for the BMJ, and I'm just going to go into maybe another one of our journals. As I said a few moments ago, they look a little bit different. So if I go into gut, for instance, the other journals will have this sort of look and feel. In terms of email alerts, just so I don't forget, they're quite easy to set up. Simply click on here and just continue with the sort of screen here. Of course, if you have already an account, it'll ask you to enter your password. And once you have this account, you'll actually be able to manage all of the email alerts that you may have from BMJ in one place. But in terms of the other journals, as you can see, we have links to the podcasts there. We've got sometimes, even for this journal, we have visual abstracts, latest articles, and with a lot of journals, you'll also see this alt metrics. So the more widely shared on things like social media, news, and so on, you'll find these the higher score you have here. So just another way of showing widely shared or popular articles. And you can see here the various podcasts for this specific journal. And again, if I just were to open an article, actually, let's find one that's that would require me to log in. Okay, so here, if you do get to a stage where you're asked to log in, what you could do, as we said earlier, access to the journals is through Open Athens. What you could simply click on Login here, and then select Login via Open Athens. For me, I don't have an Open Athens account, but for you, you just simply go through the steps there to go through going through Open Athens. Again, yeah, so that was again just a very quick walk through the journals. Of course, if you wish to, instead of simply signing up for email alerts and maybe just accessing the articles that come through the email alerts, you can of course either search conduct quick searches on our journals. You can conduct searches through all of our journals platforms as well. But I think for today, I'm going to leave it at this, unless there are some questions at the end of the session. So that was a very quick look at the journals, and please, please do. I do recommend signing up to email alerts, especially. I find the ones on the BMJ especially relevant, and for those, again, you could do it all from the same place. So you could just go here and click on email alerts, the same thing that we've seen earlier. So my emails, and you can see I've got the weekly ones. There is actually one that you can do on a daily as well, but maybe that's too much for me. And you can see all of our details as well. So browse the various other journals. So you can see all the journals that we publish and the email alerts. So maybe if you're a specialist, you may want to, for example, in gastroenterology, you may want to select the gastroenterology journals that we have as an example. Okay, so yeah, very quick look at our journals. I'm going to put this to one side. I'm going to move on to BMJ best practice. We'll then come back, as I said, at the end to the other two resources. Okay, so as an introduction to BMJ best practice, I'm going to attempt to play a short video. And if it doesn't work, then please do let me know through the chat. I'm going to mute myself.
When you work in healthcare,
every day is a test. Every second counts.
And each patient's needs are unique.
It can be unpredictable, demanding,
and overwhelming.
But we rise to it.
So we can lend an ear and a soothing voice.
But to give the very best care
to those who need us most.
Sometimes we need to silence the noise.
And get our own second opinion.
Ranked one of the best clinical decision support tools for healthcare professionals worldwide. BMJ Best Practice
gives healthcare professionals
confidence when it counts.
With everything you need to make quick, informed clinical decisions,
it's an incredible tool for learning.
Backed by the latest evidence-based research.
It frees you up to focus on what really matters. Because healthcare isn't a memory test.
And with its powerful Comorbidities manager to help manage patients with multiple conditions, BMJ Best Practice is the only app that offers truly tailored patient care.
Use BMJ Best Practice within your existing setup.
Or take it with you, wherever you go. From the remotest location
до найскладніших ситуацій. BMJ Best Practice завжди поруч.
It's one of the only apps you need to be a doctor today.
It's helped me save time.
And lives.
And it's made me a better doctor.
Join the thousands of users working across healthcare and make BMJ Best Practice
A part of your
Best practice.
Thank you for watching that. So that was a quick introduction to what BMJ Best Practice is. So a clinical decision support tool that is evidence-based, continually updated, and provides you with information on diagnosis, treatment, management, and prevention. It is a generalist tool, meaning it's useful for the whole healthcare team. We'll mention some of these a little later, or try and mention as many of them as possible. So things like the Comorbidities Manager, of course, will demonstrate that. Our treatment algorithms, the evidence base will kind of highlight a couple of things. And we'll also try to mention the drug formulary integration. So from within BMJ Best Practice, when you're looking at a treatment option, you'll be able to click through and it will take you straight through to the BNF or BNF for children for more information around dosing, effectiveness, and contraindications. And we'll as I said, we'll highlight the Comorbidities Manager. These slides are usually here just in case the video doesn't work. Okay, so what I'll do with access, I'd like to if you can follow these steps with me, especially if you've not used BMJ Best Practice or registered with BMJ Best Practice before, what I'd like to do is show you how to do it on a browser, on a computer, and then follow the app with this. Really, there's very similar steps on how to do it on the app. If you prefer to start on the app, then we'll skip the website bit and then start straight on the app, especially if you can if you're following us on a computer and then just download the app at the same time. So let's get started. So in terms of accessing BMJ Best Practice on a computer or using an internet browser, a web browser, all you need to do really is just visit bestpractice.bmj.com and you can start using the website. What we do encourage you to do, strongly encourage you to do, is click on Start Tracking CME CPD Credits at the top or complete your profile. There are a number of reasons for this. For example, you'll be able to log into the app directly. You'll be able to track your, as it says there, CPD activity, and there are a number of personalization features. And then there are a number of steps to do to register or set up your accounts. But make sure you select an email address that you've got access to. So yeah, just a couple of steps. Enter email address and password. We'll send you a code, enter it onto the next screen, and then continue with best practice. So those are the steps on the website. If you prefer to start from the app, and of course, once you do that, it doesn't stop you from downloading the app and then logging into it. So you could always do that. So you can start on the website, then download the app and log into it. But the majority of healthcare professionals I speak with prefer to just get started on the app. And these are the steps on the app, and these are the steps that have been, as was mentioned a little earlier, when I'm on site. These are the steps that I show the healthcare professionals. So you open the app. You only need 2 clicks really. So select once you open the app, select the button at the bottom of the screen where it says Network Wi-Fi. I'll then ask you just to confirm and click continue. So you don't actually have to be connected to a Wi-Fi, but those are the steps. That QR code should take you to the App Store or Google Play. As I said earlier, if you've got your phone with you, and you could do that right now. So just scan that QR code or search for BMJ Best Practice on the App Store or Google Play. Once you open the app, select Network/Wi-Fi. It'll ask for a confirmation. Just click continue. It'll do a little bit of thinking on the next screen, and then it will start to download the content. And that's how easy it is. just all you need to do is 2 clicks. It'll then download the full content. You'll then be able to use it offline wherever you are, so you don't really need internet connection. And once that's done, you'll see this screen here. And so you see all the navigation menu and so on. And instead of this icon, this prompt, you'll be prompted to set up your account with us. Again, you can use the app without setting up an account, but we strongly advise you to set up an account. As I said earlier, you'll be able to use it for your CPD needs. You'll be able to use bookmarks, and there are some other features as well that are linked to having a personal account. And these are exactly the same steps that we've just seen, right? So simply set up an email address and a password, and as we've discussed earlier. So again, if there are any questions at the end of the session, quite happy to run you through these steps again. And as we've seen on the video, it is the highest rated clinical decision support app on both iOS and Android platforms. It is a very much loved app. And from my recent visit to one of those 3 hospitals, one of the doctors, it was, it kept saying to her colleagues that it's the best clinical decision support app she's seen. And that's really the sort of feedback that we get, or I personally get when I'm going around the various hospitals. So that was access. Now, now we'd like to take you through a demo of the tool. So I'm going to go now onto the website and do that. Okay, so as I said, it's going to be a quick demo of the site, just highlighting some of the most used sections and maybe a couple of other sections as well. So I'm here at the home page. Because I'm logged into my account, I get these alerts here. So any topic I've used in the past that's had an important update, I'm alerted to that. And the same applies on the app. So if you're logged into the app, and a topic you've viewed in the past has an important update, you'll be alerted to it as well. So you can see some of the recent topics I've viewed and that have had updates. You can see here some important updates on this screen, on this section rather, including a new BMJ best practice topic that has been that was launched a couple of weeks ago now. Okay. Homepage is fairly sort of straightforward. As we said earlier, the content is continually updated. If you'd like to see a clinical updates, you can click there. You can browse through a number of specialties, so you can see what they are through here. You can also have quick access to our calculators that are, of course, linked from within topics. We do have patient information leaflets, again, linked from within topics, but easily accessible from here. So if I go into, just to show you one of these are in plain English. They don't use any of the medical jargon. And sometimes you do have these different types of patient leaflets. So questions to ask your doctor is one of those types of leaflets that you may have seen here. For example, ADHD in adults, strategies for managing daily tasks and questions to ask a doctor. There are a couple of more here as well. What is it? What treatment options? Or what are these treatment options? So these are, of course, as I said, will be linked from within topics. We do have lots of multimedia content as well on BMJ Best Practice, and these will be useful for learning and also, for example, to maybe refresh memory before doing a procedure you've not done in a while, maybe. Lots of common clinical procedures here, but there are other types of videos. So assessing older patients, sort of history taking, right? So this is an example, but there are things like auscultation sounds, and various educational content, or rather patient education type. So this is dry powder inhalers by a pharmacist, showing how they're used. So those are again linked from within topics, but available here. If you'd like to find out more about our evidence processes, there is information here. And if you'd like to look at all our comorbidities topics, comorbidities managed topics, you can click there. And then for those with an interest in evidence-based medicine, how to explain EBM to patients, how to appraise systematic reviews, randomized control trials, and so on, we do have an EBM toolkit in this link here, evidence resources. A quick brief mention of case reports. Here you'll actually just find case reports on rare diseases and common presentations of more common conditions. And the way you can surface those, you can search for those. So if I do COPD here, of course I can use these also suggestions to jump straight into what I'm after, but I'm just going to show you the results page. Here, if you are interested in case reports, you'll have to select this filter here, right? Alternatively, you'll see the clinical topics that we'll go into in a second. The same applies if you're interested in multimedia. Maybe you'd like to show something to an image to a patient. Maybe it's something you want to use it for other purposes. What comes up here, again, some of those educational type videos in terms of how to use certain medication. So you'll see both images and videos here, and of course you can expand these. So let's go into a topic. I've gone into acute exacerbation of COPD. So here, of course, one of the things that healthcare professionals really like about BMJ best practice is that it's very easy to get to the information you're after. With the navigation that follows the sort of clinical workflow. The homepage has the highlights of the various sections. We've got a quick short summary of the topic. You have a definition, various highlights of the topic, but also details of all the experts contributors. Of course, for those in a learning environment, theory will be useful. For those maybe who'd like to learn about a condition, maybe if you're a nurse who'd like to learn a bit more about a condition that your patient has, the patient that you're looking after has, so this could be useful for you. Of course, students as well will find this useful. So everything to do with the epidemiology, etiology, risk factors, case histories as well here. So all of that is useful for learning. Usually what we hear from healthcare professionals, especially with doctors, they say they use these sections more, things like history and exam, investigations and differentials. And of course, the treatment algorithms are some of the things that are used the most within these topics by all healthcare professionals. So I'm going to show you just a few of these. So if I go into recommendations, just to show that this is a narrative sort of format. So it starts with urgent recommendations, some key recommendations, and then the full recommendations at the bottom, which can be expanded one at a time or all in one go. But looking at these other sections that I said are more used at the point of care, if I go into history and exam, so this is the layout with these sorts of expandable lists. So maybe I'm interested to find out a bit more about dyspnea, so I can just expand that and look into that. Investigations, similar sorts of formats of how they laid out, but first investigations to order. So I can click here. I see the test, the results. Here there is a video of that sort of clinical procedure. Differentials, of course, is useful again for to rule out other conditions or consider alternatives. And I'm going to jump now straight through to the treatment algorithm. So here I'll demonstrate a couple of things. Of course, how the treatment algorithm is used, but also the comorbidities manager As we've seen at the start of this, the Comorbidities Manager helps to manage the whole patient when dealing with acute conditions. So instead of simply looking after the presenting condition, you're in fact treating the whole patient. So initially, a patient with acute exacerbation of COPD, on presentation, the first line treatment is short-acting bronchodilator. I can click on this, it gives me all the various details. It will give me the drugs, the dosages. If I click on the drug, as we said earlier, you'll be able to see two options. You'll be able to see BNF and BNF for children. And if you click on here, you'll be able to, this will open the actual topic for you, or rather the monograph for this drug within BNF without having to log in again. Whilst we're here, in terms of steroids, systemic corticosteroids, you'll see all the various details here as well, but you'll also see things like all the various references, links to Cochrane Clinical Library, or Cochrane Clinical Answers from Cochrane Library, and you can go into it from there. So this is the various levels of evidence. You see evidence scores, again, that you can dig deeper into from here as well. So that's a treatment for a patient who doesn't have any other comorbidities, but these days, of course, that's quite rare. So if our patient also has diabetes, I'm actually going to select just a couple of these. So these are 10 high-cost prevalent comorbidities alongside two other considerations here. That's our tobacco dependence and suspected frailty. As you can see here, we've got a couple of pardon me, we've got depression and dementia there as well. So we've selected a few of these comorbidities, and just to show you how this impacts the management of the patient. So systemic corticosteroids, we have a few options, a few additions that have happened here. So we've been asked to manage the patient's diabetes when they're taking steroids. So some of these will, of course, relate to things like polypharmacy. So manage the patient's diabetes when they're taking steroids. You've got all the various details there. Because we've selected CKD, for those in interest with CKD, we've got a link to the Renal Drug Handbook that appears because the patient also has CKD. So maybe that's something that is of interest to you. And then with all the sections that have been impacted, we'll have this icon here. Again, some of these have been added to the management because of the comorbidities. So monitor for comorbidities during hospital stay. So what do we need to do? Check baseline kidney function and monitor closely, monitor and manage blood glucose during hospitalization, and then check your patient's feet. So again, you can expand these for further details. So that's really the comorbidities manager and the treatment algorithm in general. There are a number of other sections here, as you can see, in terms of prevention, patient discussions, things on follow-up. So what complications can occur, how likely are they to occur, and then things like guidelines. So all the authoritative international guidelines, whether they're European guidelines, NICE guidelines, North America, and the rest of the world. So all the authoritative guidelines for this specific topic will be here. And of course, you've got a link here to the GOLD guideline as well for COPD. Any images and videos used will be here, all the references, of course, for the topic. So here you can see what are the key articles for this topic, and then all of the, the rest of the articles referenced. So in this instance, you've got the, the GOLD guideline. You've got a couple of nice guidelines as well, and a couple of other guidelines here as well. So those were the sort of key articles for this specific topic. Patient information, we've mentioned that before, but they are linked from within the topic as well. In this instance, we have them available in a couple of other languages, so in Spanish and Portuguese, in addition to English, of course. I'll highlight just maybe a couple more features. Although you will have all the content offline available in the app, there are some users who do like to download content as PDFs. So you do have that feature here. But just bear in mind, of course, that with content updating, when the content is updated, your PDF won't update. So I'd recommend for people to, use the app if they want to have something offline. And then the final feature I'll highlight here is the CME or CPD feature. So if you click on here, of course, you need to be logged in. And then scroll down a little bit, you can select the month. And then when you select the month, you have the total number of credits for that specific month. There are a number of questions that you can answer, and then maybe add some reflection before clicking on save and download. This will be downloaded as a PDF and will also be saved here and claimed. So you can download it again in future. So that's how you use the sort of CPD feature. And I think at this stage, I'll just go back to the slides and just show you what the content looks like on the app if you haven't downloaded it already. So on the app, you do have that counter for the credits, but you need to log into the app to download the certificate itself. There are a number of sort of features. For example, you can jump back into recent topics. Of course, important updates, you can click on this bell here just to look at the important topics. You can browse, just like we've seen on the website, using specialties. You can have a look at our calculators, and we've got a nice little feature here with the bookmarks. So you can bookmark the calculators that maybe you use more regularly. Patient information, again, you could use this. Again, on a phone, you can actually airdrop it to a patient relative or to a patient or the carer. And then the bookmarks, you can bookmark different types of content, whether it's topics, calculators, or maybe even patient leaflets. And in terms of the layout of the content, very similar to what we've seen, those headings and subheadings, but these are just listed sort of vertically instead of horizontally across the computer screen. And similarly with the Comorbidities Manager, this icon means that the topic or the treatment algorithm has the Comorbidities Manager, and when you click on it, you'll have the option to simply add the various comorbidities that are relevant to the patient. And again, just as we've seen on the website, you do still have access to the evidence base, to those links if you need to. So that was a quick look at BMJ best practice. I hopefully I didn't go too fast through this. I wanted to get a better time to highlight some of the other resources that are available to you. Again, if there are any questions, please do feel free to put that in chat, and we'll address them a little later. So what we've done so far, just so it doesn't get too complicated, we've highlighted briefly that you've got access to our journals. So the journals that we publish, we looked at our clinical decision support tool, which is BMJ best practice. Now I'd like to briefly speak about our learning platform, BMJ Learning, which is an online learning platform for healthcare professionals that offers hundreds of evidence-based learning courses that are, of course, can be used for CPD purposes. Pardon me. We know that on average, by completing the course on BMJ Learning, you'll improve your knowledge by 36%. We do this by comparing your pre-test scores when you start a course with your actual scores at the end of the course. As of course a very loved resource around the world, and 95% of users that we've asked said that BMJ Learning has had an impact on their clinical practice. So in terms of accessing BMJ Learning, this is done through your through Open Athens. So I'm just gonna very quickly show you how you start. So this to get started, you can click on either login or sign up. It doesn't really matter. So let's go with login actually, because it's more less confusing, I guess. So if you start with learning, login, and then click on login with Open Athens, and then simply enter your institution, right? So you can start here and then go through and enter your Open Athens credentials. Of course, the library can support you if you don't actually have an Open Athens account, and we can maybe have more advice on that later. Once you're through those steps with signing up with logging in with Open Athens, you can then log into your existing BMJ account, right? So because you've already got an account with BMJ Best Practice, once you've gone in through Open Athens, you can then enter your BMJ account details and log in with that as well. So you'll use both initially. In future, you can just use one, but the very first time you access, you'll go in through Open Athens, then go in with your BMJ account details. And I'm not sure what I've done there, so I'm just going to close my other windows and then open that again. Okay, so yeah, just a very quick walk through the website. You can actually browse using the various specialties and collections, things like quality improvement, public health, and so on. The courses take maybe they vary in length, half an hour to an hour to complete, but you can take your time and take as long as little time as you need to complete them. You can see all the courses have very good reviews and ratings. Various specialties you can browse, as we said earlier, and then if I continue scrolling down, check your skills. And these ones, what we do is that we actually we ask you to tell us how confident you are with your answers in the pre-test, and then based on that, we can prioritize chapters for learning. So you can see what your learning gaps are. Recently updated guidelines, and then if you'd like to see what are our non-clinical topics on BMJ Learning, you click on View All. Just going back there, sorry, just a second. I was at the bottom of the screen, and then I clicked on View All Collections, and here you can see the non-clinical courses or collections, so groups of courses: communication skills, leadership, quality improvement, well-being, study sports, professional skills development, career development, and equality. So these are various collections. Of course, some of the more popular ones are ECG skills, and then we've got some practical skills courses as well. Okay, and as I said, it's very straightforward. If I click one of these, this is a collection, of course, but I can go into the first one here. I've previously started, so I can jump back into it and continue my learning. And again, it's very straightforward. And once I'm done, I can download my certificate. So this is a short, popular course. You go through the learning here, and then there is the test, the final assessment. Once you've gone through the final assessment, then you can download your certificate. I'm just going to click home here, and I'm going to go into my portfolio where I can find any previously completed courses. So these are the ones I've previously completed rather, and I can jump into them to download my certificate if I need to. So I'm going to click onto that one there, view course, and now I can download that certificate. Okay, so that's BMJ Learning, very briefly. And let's continue. And please do just one more thing actually on BMJ Learning. So for those, let's just go. Let's see. It's just a quick tip. Okay, so if I go and search for a very basic general term course, and then potentially interested in only courses that are relevant for nurses, what I could do, I can search for a generic term and then go into professions and then use the profession filter to select my profession. Maybe I'm a health professional, maybe I'm a doctor. As I said earlier, I could be a nurse. and then I can select maybe specialist nurses and nurses, and then click apply. Then I'll have the courses that are relevant to me. But of course, that still relieves quite a lot of courses. Maybe you want to make your search a little bit more, refined, a more specific term. So that's just a quick tip in terms of searching for courses. Okay, now I'm gonna. So that was BMJ Learning, our learning platform. Please do, use it. And the last thing I wanted to highlight, or resource I wanted to highlight, is BMJ Case Reports. You've heard me speak about case reports earlier in BMJ Best Practice, but this is actually the pardon me, the journal itself. So with BMJ Case Reports, it's actually the largest collection of clinical cases in the world, clinically important cases in the world, and they don't just feature rare conditions; they also feature, common conditions as well. And what you have the ability to do is not only read the thousands of cases available on the website, but also you can submit to us an unlimited number of cases for publication with us. So you can work in teams, for example, on an interesting case and get that published with us. Of course, you'll need to follow the advice on the website in terms of the requirements for the journal itself, and it will of course go through peer review. But as I said, there are no limits on the number of cases you can submit, and also the advice on the website is very intuitive and very, the website is also the journal's very supportive as well. And I'll just show you a couple of things on the site. So if I go into casereports.bmj.com, I'll just show you a couple of things here. Initially, instructions for authors. If you'd like to, read about that, my advice is to simply read. Maybe download the guide, read the guide, or the guide, even if you're not currently looking to submit a case report, just so that in future, when that thought crosses your mind, when you think there's an interesting case, you know exactly what it is you need to submit a case. So this is where you find all the advice you might need if you're interested to submitting a case with us. And as you can see here, we've got quite a high acceptance rate for the journal. Again, I'll leave it just as this. I don't want to, it's probably already overwhelming, but for those who have an interest in this, then please do get in touch, ask questions. And the second thing I'd like to highlight with this journal is, like, when you come to submitting your case reports, you will need a fellowship code. So do request that from your library. So when you come to submitting the case reports here, you will need a code. So that's something else that you need to obtain from the library. I think we'll leave it at that and leave some time for questions. Thank you very much for your time.
Thanks, Ali. I'm just going to stop the recording now.